and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we're going to talk about treatment of mental health, behavioral health issues. My guest is Ryan Dudley from the Community Services Board. I almost use the acronym. I hate to use acronyms.
That's completely fine.
Welcome, Ryan.
Thank you for having us.
So, one of the things that Virginia has become aware of, and this area has become aware of, is the challenges in getting people to behavioral health, to mental health services, that you might have to sit in an emergency room for days until a bed opens up. I mean, it has been a real barrier and a real problem. What is going to happen that will hopefully alleviate some of that?
Absolutely. The Community Services Board has certainly been a partner with the city, and we're an extension of the local government. Mm-hmm. And so we work with our partners, and we also experience the frustration of the inability to get a timely access of treatment at times. As you indicated, individuals are often, by default, sent to emergency room departments. Law enforcement is involved, and all with the goal of trying to assist the individual. And over time, the psychiatric bed crisis in Virginia has continued to become more problematic. Individuals waiting days and oftentimes not in a very therapeutic environment. So one of our partnerships and our opportunities is we're developing a model called the Crisis Receiving Center. And we have chosen to name it the B.J. Roberts Behavioral Health Center.
Oh, that's so sweet.
Absolutely. Named after the long-term Sheriff B.J. Roberts, who's also a behavioral health advocate and had been a member of our board of directors for close to a decade.
Right, because a lot of time people end up in a jail situation when they didn't need to get there, but they are there. And then they have to treat people, and it's probably not the optimal place to treat people either.
Absolutely. Unfortunately, our jails, our emergency room departments, neither are optimal in order to access the treatment, to appropriately provide the treatment. And so what this will allow us to do is have multiple entry points and bring close capacity within the area. And oftentimes when we are able to locate a inpatient bed, it may be out of the area. Mm-hmm. So we're bringing the capacity back to the area. This is going to allow us to create an environment that's a much more empathetic approach.
Right.
For an individual that can walk in independently, assisted by a family member, or be assisted by a mobile crisis team or law enforcement. As I stated, a lot of times the default has become law enforcement, and for them to also have the ability to access this, to bring somebody and to also expeditiously get them involved in the treatment.
So what is the common way that law enforcement becomes involved? And explain to people that process, because I don't think they understand what happens.
Absolutely, and it can be a complicated process, but oftentimes law enforcement may be called out to a scene, and at times they may have to initiate an emergency custody order, which that enables them to take an individual in custody for the purpose of the community service to determine if they may need involuntary hospitalization. The goal, of course, is, along with new additions to our crisis system, Marcus Alert, Mobile Crisis, have the ability to assist individuals at any level of crisis to access. Mm-hmm. And if an individual is on an emergency custody order, law enforcement does continue to maintain custody of that individual. But we're
that's a lot.
It's
if you're looking at somebody who, a lot of incidents happen on the weekend, not necessarily, but they could pick somebody up on a Friday, and you're not going to have the custody order until Monday at the earliest. It's just a long time, and it's not the best use maybe of our taxpayer dollars and of our highly trained police staff that have lots of other things to do.
Absolutely. There's certainly multiple components and orders that are involved in that, but it does really take our law enforcement from other public safety duties, other community policing initiatives they have. But we do have a strong partnership with our police, so mm-hmm. we're certainly know that they're going to welcome this, as well as our community. Again, focus on individuals of different levels of crisis, whether voluntary, involuntary.
Well, and that's what I was going to say. Yeah, you have people where law enforcement's involved, and that's a public funding, public safety issue. But you also have people who walk in, need treatment, and they can be stuck in an emergency room
Absolutely.
for like 5 days. And it's not, I mean, it's completely understandable, but it's not a welcoming environment. Like, you're in a place with a bed and nothing else. You can't have a device. You can't, charge things. It's unless someone's being really nice, which they often are. But you're just stuck, and you're on suicide watch. So there's a camera in your
Right.
room, and your door's open. And if someone is really in turmoil, that's not really necessarily helping.
Absolutely. And so one thing we're really focused on and is creating an environment where not only we can engage somebody in treatment, but they're going to be willing and respect the process to come back. Not after having a situation, as you described, many people have, with or without law enforcement, but in an ER for such a long duration.
And it's not
before
what
they're
the
getting
ER should be.
treatment.
People are in there for broken legs and heart attacks, and that's what it's set up for. It's not necessarily set up for this.
I think one important aspect of this is Centera Careplex Hospital and Centera Healthcare are a strong partner
Yeah.
in the development of this. They certainly see the benefit. They're a partner in the current circumstances we deal with.
Sure. That's the emergency room in Hampton, so certainly people could go other places, but that's kind of the default place.
Absolutely. But the cities that we work with, City of Hampton, they're a strong partnership. There's an investment made from the city recognizing the need for this for their citizens and,
Right.
and really trying to help us address the stigma associated.
Yeah, people still, I kind of forgot that stigma still exists because there's been so much discussion, especially since COVID, about isolation, mental health. The number of people suffering from depression jumped tremendously. So I tend to think that's gone, but it's not, right?
It is not. I think there's a recognition that more individuals are experiencing mental health, but there's still the stigma around certain situations or who or what circumstances. And so
Yeah.
we're excited. We're excited that the community stakeholders are excited in the long-term plan.
Right, and that'll be good. Obviously, Centera knows their ERs aren't the best necessarily place either. So contributing to this, the city contributing it to
Absolutely.
it, hopefully we'll get it soon. When? When will this be ready, Ryan?
Well, I think we're hoping for the summer of 2024.
Oh, that is pretty quick.
Yeah,
That's
it's-
real quick, because you just got the funding approval, basically, or the additional contributions at least.
Yes, it's been long-term planning. There's many steps. We've learned a lot on it, but as we're getting closer, everybody's getting more excited, and which is more effective problem solving.
Yeah, absolutely. Well, is there anything else? I mean, while we're here and we're talking about, I'm just going to throw in, this is not just crisis stabilization. This would get people into a longer-term treatment plan because generally, you don't solve this overnight.
The Community Service Board has a wide range of services. We're again, 52 years we've been serving the community, but at the site, again, individuals walk in, be able to provide an assessment, perhaps start treatment, and identify what level of care they may need.
Right.
It could be services, supports, linkages. It could be that 23-hour observation treatment services that we'll have that gives us more time to identify and facilitate a plan. And then we'll also expand the number of residential crisis stabilization beds that we have on site.
That'll be tremendous, I think. I think that's a huge benefit for our community, for our police, for our medical teams, to be able to have that option. That's great.
Thank you.
Anything else?
No, we appreciate the opportunity and appreciate the support of the city.
Well, I appreciate what the Community Services Board is doing, and a lot of people, this will skate right past them because they don't have a friend or family member in crisis, but if you do, you know what the situation is and how truly beneficial this is going to be.
Absolutely. Well, we look forward to providing more education to the community about what we will be doing, and certainly when we're ready.
Well,
thank you very much.
And I hope you have learned a little about what can go on when someone needs critical mental health care and how we can, as a society, make it better with the City of Hampton, the Community Services Board contributing, Centera as a partner, all working together, we can create more of a web of support. Thanks for watching.